Hey, good afternoon, everyone. So I want to start off first and foremost with a big thank you to the entire team that's been a part of the vaccine effort. There are hundreds of people who have been working tremendously hard to get us those decreases that Dr. Chan highlighted and to drive us toward those key milestones that the governor shared previously. Now, those immunization metrics are still going to be meaningful for us moving forward. However, as we enter this next phase of the vaccination effort, we're going to be thinking about success a bit differently. So a couple months ago, we set a goal of getting 70% of eligible Rhode Islanders at least partially vaccinated by the end of this week. And that 70% represents about 614,000 people. And this is ahead of the goal shared by President Biden just this week to get 70% of all eligible Americans vaccinated by July 4th. So when you look at the universe of Rhode Island, those that live, work, and learn here, we're essentially there. When we factor in all of the additional vaccinations that we've done in Rhode Island among those that have come across the border because they live here, they work here or they learn here, we've vaccinated with a first dose about 600,000 people. What got us there was all of the work that we did in phase 2 to set up a large, fast, integrated vaccination administration network with more than 150 locations throughout the state. Now, phase 2 of this campaign was about vaccinating as many people as quickly as we possibly could. And the entire team here and the state as a whole has been very successful there. So we can now begin to start shifting towards working more strategically to connect with those Rhode Islanders that are remaining to be vaccinated. It's less about volume and more about being hyper-targeted. So there are currently about 280,000 eligible Rhode Islanders, 16 and older, that have not yet been vaccinated. And we think about those 280,000 Rhode Islanders in kind of 3 different categories as we think about some of our solutions and ways to reach them. So the first group of people are those that, for one reason or another, are unwilling to be vaccinated right now. Now, this group is relatively small, but we know needs a high degree of engagement. How can we provide the right information? How can we reduce barriers to getting them vaccinated? Most unvaccinated adults fall into one of 2 other categories. People who are uncertain for a variety of reasons. They might have questions. Again, access might be a challenge. And people who are willing to be vaccinated, but just haven't done so yet. So when I said earlier that we're redefining what success looks like, what I mean is that vaccinating 10 people who are in that unwilling category is going to be just as much of a win for us as vaccinating 50 in that willing category. Those folks that just need a little bit of a nudge. We're in a phase of the campaign that is requiring us to be much more strategic. This is where the real hard work happens, the pick and shovel work, as the governor mentioned. So what does this look like? And we've already begun this over the last couple of weeks. It's getting into schools. A huge thank you to the team at the Rhode Island Department of Education and all of our school and municipal leaders throughout the state that worked so quickly to get these clinics set up. It's doing work site clinics in settings where we know we'll connect with more working age Rhode Islanders and getting communications and education materials into gyms, grocery stores, and other settings where we know we can reach that population between 25 and 35 years old. We're creating more flexibility for people to get vaccinated across our network when we're talking about same-day appointments and no appointment vaccinations. And then, as the governor mentioned earlier, we focus on those Rhode Islanders that remain most vulnerable. Starting next week, we're planning outreach to our older Rhode Islanders, 75 plus, that have not yet been vaccinated. And that's still about 13,500 Rhode Islanders. And when I say outreach, we're not sending them a text, we're not sending them an email, we're calling them and we're asking them when we can bring a dose of the vaccine to their door. So we're going to be working to provide at-home vaccinations for all those Rhode Islanders 75 plus over the next several weeks. This is an expansion upon the program that we started for homebound Rhode Islanders over a month ago, and we're exploring multiple mobile and pop-up clinic opportunities here as part of the broader phase 3. We're also ensuring that we're going to continue to increase our messaging, ensure that this remains top of mind. And while it's great news that all of our public health metrics are all moving in the right direction, it's still important that people continue to get vaccinated so that we're resilient as a state. We're going to do everything we can to ensure that every single Rhode Islander is given the opportunity to get vaccinated against COVID-19. We're putting the vaccine in the path of every single eligible Rhode Islander. Every time we vaccinate someone else, we're helping to bring our transmission rates down. Now, we don't know what the future holds, but we continue to plan and prepare to ensure that we can remain proactive and we're ready for anything. But what we do know with absolute certainty is that we can get our case numbers low enough to allow us to fully reopen. And to make COVID-19 a manageable disease in Rhode Island, in the same way that the flu, while a serious but also manageable disease. And we know that we can do this before the fall. But as Dr. Chan said, it takes all of us. So please, we're making this appeal to you again. Do your part. Get vaccinated. Every Rhode Islander that gets vaccinated makes us as a state that much more resilient against COVID.